This is the Ganta Ebola Treatment Unit in Nimba County. Unlike other ETUs, the Ganta Treatment Center did not register any confirmed Ebola case. However, 41 suspected cases were recorded and over 4,000 people were screened at that ETU. The Ganta Ebola Treatment Unit was built by the U.S. Department of Defense and is being managed by an international non-governmental organization, Project Concern International. PCR for short was given $5.6 million United States dollars to, among other things, run the affairs of the Ganta ETU. Though no confirmed Ebola case was recorded, but according to the chief of party of the PCR's support to Ebola Treatment Unit project, Dr. Tell, over 60% of the $5.6 million United States dollars has been spent.
Nearly from the total budget, around 30% is allocated to those specific items: PPE, infection prevention, medicine and drugs, and protective elements. Another 30% is for staff capacity building, which is part of the program supply also, building capacity of the staff.
One of the 56 health workers who benefited from the PCR's health training is Cyrus Kedon.
We were fully trained at the Lassa standpoint, at the Ebola standpoint. We were trained by the WHO, and we are going for many seminars. So, in the absence of our big bosses, like the medical doctors, the epidemiologists, with the nurses, the PA, I think we can combat with what they have taught us, because they are the role model for us. So in the absence, we can work.
Prior to the construction of the Ganta ETU, PCR in collaboration with the county health team were operating at the Ganta Methodist Eye Clinic, where only one confirmed Ebola case was recorded on December 19th of 2014. But how does the PCR's step chief of party feels about the timing of the Ganta ETU construction?
If it comes in epidemic, this is the ideal way to manage it. But it just started late. We could have, for example, we had this facility March last year. Okay? We could have saved lives, especially the health professional lives, because they were the one on the front line. And we could have minimized a lot of risks. And yet, these facilities have, although established late, they have done a great, they played a great role, because still, we contained the infection. We just make it stable, and we have no cases as we have in the other two countries. So they played a role, a great role, but their impact could have been more stronger and more wider had this facility been earlier.
During emergency case, ETUs are built for temporary purposes and not for permanent structures. So what does the local health authority, including the people in Nimba, thinks about the planned demolition of the Ganta ETU after the end of the PCR's operation on December 31st, 2015?
We wouldn't like to see a decommissioning of the ETU in Ganta, but what we need to see is a renaming and restyling the ETU in Ganta so as to serve as a center for infectious disease in Nimba. We know that Nimba has over 500,000 population, and besides that, we also will be able to cater to people coming from the southeast as well. So if we can have a center for infectious diseases in Ganta, we think it will go a long way.
Apart from the Ebola, but when you for other sicknesses, we agree because we have so many human beings around here that will get sick. So when I get money to carry children to hospital, big hospital, that can help the community.
We're not supporting them breaking it down. We can even keep that area for different use. They got so many diseases around that we know about. They got cholera, they even got Lassa with some other sicknesses that people know are dangerous to our health. So for me, I'm supporting the work breaking that area down. can clean that area. They can even make that area a TV annex. Because our old annex that we're using in the area is not conducive now for human use. So that area said we can use it. We got so many use for that area in the country.
Currently, no patient is in the Ganta ETU, but the 56 trained health workers are now in various communities in the county spreading the message of Ebola. The question now is, what becomes of the remaining 40% of the $5.6 million United States dollars after the completion of the PCR's support to Ebola treatment unit project?
The expense of running an ETU and the expense of patient care is very high, to be totally honest, especially in a disease like this. So do I think that we're going to expend all of the money? It is our hope that we will appropriately expend U.S. government money. I'm a U.S. government taxpayer. I want to utilize that money in the best possible way. If we feel that we do not expend it, we'll return it to our government.
With the scoring cost of running the ETU, it's not sure how much money will be left at the end of the day. From Ganta City, Nimba County, I'm Julius Compton reporting for Sky News.